My name is Susan Brisendine, and I'm on the Patient Advocacy team at Bluebird Bio. And I'm here to provide the community with an update on gene therapy treatment centers and support resources. So, briefly, what we'll cover is an update on educational materials, an overview of Bluebird's Qualified Treatment Center network, and some information about My Bluebird Support, our patient services program. And Bluebird Bio was specifically invited by ALD Alliance to present what will be discussed on the following slides as part of our sponsorship of this conference. So I won't go into too much detail on this slide, but just wanted to share a little bit about how Bluebird is leading the way in gene therapy from the standpoint of our clinical leadership, our validated platform, and our commitment to ALD. We've collaborated with the ALD community for over 14 years now, beginning with the founding of our company in 2010, when we had the goal of identifying a treatment for CALD. So where is Bluebird gene therapy offered? Specialized hospitals will be certified as qualified treatment centers, or for short, QTCs. And the focused QTC network was selected based on really experience with transplant and cell and gene therapy, and also the center's expertise in CALD specifically. And all QTCs are specifically trained to administer Bluebird gene therapy. It's important for them to be trained as they play a critical role in manufacturing by collecting the patient cells that are then used to make Bluebird gene therapy. And our patient services program, My Bluebird Support, can certainly provide more information about the QTC network. The initial Qualified Treatment Center network for CALD includes 4 centers right now. The blue stars represent those centers that are activated, and the pink star is an activation currently in progress. So if you're considering a one-time Bluebird Bio gene therapy, we want to make sure you're supported. And My Bluebird Support is our patient services program that connects you with experienced patient navigators. And those patient navigators provide education on the Bluebird Bio treatment process, how to find a QTC, how to connect with a patient advocacy organization for additional resources and support. And if you're not already associated with a QTC, My Bluebird Support can assist in scheduling a consultation with a location that takes your insurance. Also help just navigating insurance, including benefits verification and explanation of the authorization process and your out-of-pocket costs. And support really at all phases of the gene therapy journey, including logistics and financial support for eligible patients. And you can enroll at any time throughout your child's treatment journey. And by enrolling in My Bluebird Support, you're not signing up for treatment, just to start the conversation with a patient navigator, so you can get resources and answers to your questions and assistance with next steps. There is a full list of services that's available on mybluebirdsupport.com, and we've provided a QR code here on this slide for easy access to that website, along with some other contact information. So you can connect with a patient navigator at any time in your decision-making process. A printed caregiver brochure and this presentation, the slides that I'm presenting now, were made available at the table in the back of the room at the conference. For those joining virtually or those that just didn't get to pick up a copy, we've certainly tried to make it easier for you. We've provided a QR code here that links to that caregiver brochure and website. Well, thank you. Thank you for tuning into this presentation to hear about our educational material updates, the QTC Qualified Treatment Center network, as well as My Bluebird Support, our patient services program. We look forward to seeing you again soon. Thank you.
It's daunting when you get a diagnosis of ALD.
I think one of the most beautiful things about our community is how we support each other.
Now, the outlook is much better than it was in the past.
I hope that we keep moving forward in the CALD community. And I believe that we will get there. So I want us all to keep fighting, and I want us all to keep fighting together.